This your Houston chiropractor, and we've got Sean here back with us today for his 8th visit. This is Thursday afternoon in Houston, and Sean flew all the way over here from London to get treatment for his hiatal hernia that you've had for how many years? 15?
15 years.
15 years.
Yeah.
And I'm going to let him explain after we get done how this is done for him, and let him tell you what it's done for him and whether he'd recommend doing this yourself. But let's go ahead and check you out and do your last treatment today. So let's have you close your eyes and flex your head forward and backwards for me, please. Now, checking his posture right now, he's got excellent posture. He's centered up, and you can go back to neutral then. Good. Yep, his head's right straight in the middle. It's not tilting anymore. His pelvis is in the center. His ribs are lined up much better. No rotation, so it's looking good there. Okay, let's go ahead and decompress you here today. For the last one. Yeah. I know some of you have made comments on our YouTube channel regarding our new camera and our new mic and all that. Before we had complaints that people couldn't hear us, so we went ahead and got us a Bluetooth wireless mic so that you can hear us a little bit better. And the camera's the iPhone 6 Plus, so it's supposedly the best camera on the market, but we'll continue to evaluate and see which one works out the best for us, and try to bring you the best possible product that we can for treating real patients with real problems, and discussing what we're doing to actually help them with that. So, okay, Sean, let's have you take a deep breath in. Okay, that was a little smoother today.
Yeah.
Okay, just lay right there. The guy's still kicking. Okay, there we go. And just lay your head in my hands like that. Pillow. There, good. So I'm trying to talk a little softer, so hopefully it's not so loud in your ears. Okay. Excellent. Let's roll sideways, and let's come over here on your tummy first. Yeah, sure. Now we've done something a little different with Sean too that's helped him tremendously here throughout the week, which I haven't done previously on hiatal hernia patients and people who feel that bloating, heavy feeling down in their lower abdomen. But his legs are even, but we're still going to adjust his pelvis here with the left sacroiliac first, then the right one in the oblique 45-degree angle that the sacroiliac joints are in, and then the sacrum straight superior to inferior, L5 straight down the Z-axis posterior to anterior, L4, L3, L2, and L1. And then, okay, I want to put your head down just a little bit though. Please joints up. If you scoot up in there just a tad. There we go. Excellent. Very good. Yep. Okay. That's all of them. So we have had not to use the turbinator on him this week because he hasn't had that many huge trigger points in his paraspinal muscles or in the gluteus medius or maximus muscles. So we're doing some deep vibratory percussion on here that influxes blood nutrition into the area, oxygen nutrition, so that the cells can heal up. It does open up the fascia and let the blood carry in oxygen nutrition and also carry out the metabolic waste products of normal cellular metabolism. Make sure you get these rib cage evenly on both sides. Sean, I'm going to turn you on your back now and have you you slide all the way down on the table, and I'm going to realign your ribs first. Yeah, a little bit more. There you go. Okay, now let's just put your arms out and up. And I'm adjusting his AC joints, which is the acromioclavicular joints bilaterally, and then the clavicle where it attaches to the sternum, which is sternoclavicular joint, and then the ribs where they attach to the sternum, which is the costosternal joints. There we go. Good. Now let's slide you all the way back up that way. And we've also taught his mother, Pat, how to pull his stomach back down through the diaphragm, which you find the sternum here, and then you find the very end of it, down to the xiphoid process, and you go below that, there's a little soft spot. That's where you go in. I just want to show you where his ribs are right now. See, his ribs are lined up evenly now from side to side, as where before they were tilted like this, and now they are exactly even from side to side, so we've got good symmetry. Take a deep breath in. There you go. And now just go straight down in, grab the stomach, pull it all the way down, and let's do that again. Sometimes when you do this, you'll feel a little pop or a little gurgle in there. And one more time. Which we're not feeling that on him a lot right now because we've already got his stomach pulled down there, and it seems to be staying down there pretty good this week. I'll let him tell you about that. One of the things we kind of freak patients out. Now this is the new technique that I've been doing. It's just really a colon massage with the guinea rub. And it helps kind of get rid of some of the bloating and the gas down in your colon. Gets things moving, motility in your gastrointestinal tract. Acid reflux or hiatal hernia is a part of the GERD family, which is gastroesophageal reflux disease, and that affects the entire gastrointestinal system. So we've been working on viscerosomatic and somatovisceral reflexes on him all week, as well as working directly on the spine, the structure, so that we can get the ribs lined up properly. Excellent. Okay. So let's have you sit up and face towards your knee here now. There we go. Good. Alright, so you can see his posture is much better even sitting. His chin's up and his head's up and back. Shoulders are moving great. Go. Good. Just get your elbow and your wrist here. Just let these go. There you go. That's it. There we go. Good. Excellent. We do adjust extremities on every patient who walks in the door here because they're all part of the body. Okay, Sean, would you mind tell me how many miles did you fly over? How many miles is it from London here?
I've got no idea, but it's
a lot.
9 hours.
9-hour flight. That's a long haul.
It's a long trip.
So would you mind telling our YouTube subscribers how you've done when you first came here and what we talked about all week and how you've done?
Yeah, sure. Well, as I mentioned previously, 15 years I've had this hiatal hernia, although it was only really diagnosed after about 3 years. And it was after the last 3 years with an endoscopy, and the last previous 3 years have been hell. I've had a real tight tension in just
right
below my
base your sternum there.
Yeah, and it was progressively getting worse. It got to the stage where I wasn't having a proper meal a day, just maybe one meal a day very early in the day. I was scared to eat, and causing a hell of a lot of anxiety.
And you're taking a lot of medicine too,
and,
right?
Yeah, I've been on various anti-acid PPIs, they call them in the UK. And what I actually did, which I mentioned to you earlier, is that before I actually started getting the treatment, I'd stopped taking them because I wanted to see.
Yeah, this week right here when you got here.
This week.
Yeah.
And I mean, to be honest, the results have been superb.
Yeah.
You know,
So
I've had no acid reflux. I've been eating things that wouldn't normally eat.
Yeah.
Or
Like when you first got here, I told you to go eat anything and everything.
Yeah.
And that kind of freaks people out first who've had acid reflux, because they go eat a McDonald's cheeseburger or whatever, and they have severe problems for a week or two.
Yeah.
So we just told him to go eat everything he wants to eat all week. I did not tell him to not take his medications. I don't do that with any patient. That's not really our scope of practice, but he did that on his own, and he's functioned well without them.
Yeah, I mean, I've been drinking Coca-Cola. Fizzy things have always been a problem because it creates a lot of tension.
Right.
Been drinking that, I can feel it sort of just sliding down.
And you've been eating at night, going to bed, sleeping flat on your back.
Yeah.
Instead of having to sit up like they tell you to all the time.
Absolutely. Yeah. And I feel like a new man, to be honest.
Praise the Lord.
Yeah, I really do feel straight. The other thing, actually, which I didn't expect was you seem to have cleared my asthma. I'm breathing. I haven't breathed as deeply as I have for years.
Well, that's how I got into chiropractic asthma. I didn't have it as a child, but I had playing on the couch with my sister in the 6th grade and fell off backwards, hit my head and knocked a vertebra out in my upper back and lower neck, and I started developing severe asthma.
Yeah. And
I got steroids and medications, allergy shots twice a week for 2 years. In 6th grade, that's not much fun for a kid.
No.
And in the 8th grade, my mom finally took me to a chiropractor, and within 3 months, no more asthma, no more allergies, no more shots, no more anything.
Yeah.
So that's when I decided I was going to become a chiropractor. I went to Palmer College of Chiropractic in Davenport, Iowa. So.
Wow.
But would you recommend to people that are traveling long distances that it's worth coming here?
100%. 100%. One thing I would actually like to share is that I actually saw of Dr. Johnson on YouTube about a year ago, just under a year ago, and coming from London, we're a little bit cynical. We've seen it all, done it all, and I was a bit apprehensive. I wasn't sure, would this work for me? That was the real thing, and because if you Google enough, you'll find various negative things.
Right.
This can't work. This can't work. So it took me a long time to make that decision. But this was progressively getting worse.
Right.
And it wasn't nice. I mean, I've got 2 little girls, and I'm missing work sometimes because I'm ill. The girls are saying, "Daddy, how are you feeling today?"
You can't function.
And it got to the point where I was just tired of being tired of having
sick and tired of being sick and tired.
Yeah. So I made that decision, and I'm really glad I did. So
good.
Yeah.
Well, we're happy you came here to
Doctor.
Houston and visited with us,
We'll
and then we're still going to shoot you, so come on.
Thank you.
We're still going to shoot him, even after that nice testimonial. Okay, so we're still going to do neuromuscular re-education on his cerebellum, so let's flex it forward and backwards. And see, he's got all the way back for you, too. There you go, and then neutral. No, you're okay.
I'm okay.
Yeah. Good. Now let's do that, and I'm bringing his head all the way back up. So what we're doing here is we're just adjusting his atlas on the x-axis, and this sends a neurological barrage of information into the cerebellum. The cerebellum controls, you can relax, controls balance, posture, coordination, and all kinesthetic movement in the body. So let's have you flex forward and backwards again. This should feel even smoother. Very good. Excellent. Now back to neutral. Yep. Perfect. See his ears much back over his shoulder now. His shoulders are squared off. He's breathing easier. His rib cage is normal. And you're looking good everywhere.
Oh, thank you.
You're quite welcome, Sean. It's been a pleasure for us to see you all week. And you too, Pat. Thank you for coming over. Yes, welcome.
We'll be back.
And no matter where you're from, if you're having problems with GERD, acid reflux, hiatal hernia, please give us a call here at Advanced Chiropractic Relief, and we look forward to seeing you soon. This is your Houston chiropractor, Dr. Gregory Johnson. We'll see you next time.